coagulation cascade. So the coagulation cascade has an intrinsic and an extrinsic pathway. Intrinsic pathway is activated when there is an endothelial damage leading to exposure of collagen and kallikrein. This leads to activation of factor 12, which is also known as Hagemann factor, into factor 12A. This factor 12A in turn activates factor 11 into factor 11A, along with calcium, or in the presence of calcium, activates factor 9 into factor 9A. At this point, factor 8 is converted to factor 8A by thrombin. Factor 9A, factor 8A as well as calcium together activate factor 10A, that is converts factor 10 into factor 10A, and here the factor 5 is converted to factor 5A again by the action of thrombin. This activated factor 5A, activated factor 10A along with calcium activate factor 2 into factor 2A. Factor 2A is thrombin. This activated factor 2A activates factor 1 into factor 1A, which is fibrin. Thrombin further activates factor 13 into factor 13A. Factor 13 is also known as stabilizing factor. Multiple fibrin threads in the presence of stabilizing factor as well as calcium forms a stable fibrin clot. This constitutes the intrinsic pathway. Extrinsic pathway is quite straightforward. Whenever there is a damage to endothelial tissue, directly activates factor 3 to factor 3A. Factor 3 is hence called tissue factor. Factor 7 is also activated to factor 7A. Both of these factors combined in the presence of calcium activate the factor 10 into factor 10A and directly enter the common pathway. Hence, from the activation of factor 10, we call it common pathway. With this in mind, let's try to understand the coagulation disorders that are congenital. The first one is hemophilia A, which has a deficiency of factor 8, because of which the intrinsic pathway is affected. Wherever the intrinsic pathway is affected, the activated partial thromboplastin time is increased. Wherever the extrinsic pathway is affected, prothrombin time is increased. So in such patients where there is hemophilia A, the APTT is elevated, whereas the prothrombin time remains normal. In hemophilia B, factor 9 deficiency occurs, and because of that the factor 9 levels are affected. This again also leads to a similar condition like hemophilia A, where there is APTT which is prolonged, whereas prothrombin time which is normal. The third disease is von Willebrand disease, which also affects the factor 8 level indirectly. So this means that this patient also has a intrinsic pathway abnormality leading to an increased activated partial thromboplastin time, whereas the prothrombin time remains normal. Hemophilia C is an entity where factor 11 is affected, and because of that, because of the low factor 11, again intrinsic pathway is affected, and very similar to hemophilia A and B, here the APTT is elevated. We know that factor 2, factor 7, factor 9 and factor 10 are vitamin K dependent clotting factors. In case of a vitamin K deficiency, or when the patient is taking vitamin K antagonists such as warfarin, factor 2 is affected, factor 7 is affected, factor 9 is affected, as well as factor 10 is affected. As we can see, both intrinsic and extrinsic pathway are affected, and hence patient will have a prolongation of both APTT as well as prothrombin time.